Okay, I think we're going to kick this off to stay as close to on time as we possibly can. So welcome everyone to our second coffee talk in this mini series. Hopefully you've noted some of the information on the screen about the Q&A and how you'll be able to interact with our presenters and our facilitator today. There's also a little bio on our speakers, Dr. Merle Olson, Dr. Thomas Eady, and our facilitator, Dr. Dennis Plugas today. So without taking up more of the time, I am going to turn this right over to Merle so he can share with you all the wonderful information that he has.
Okay. Anyway, I just want to repeat myself. It's been a real pleasure here to be able to present to you on this today, and we're going to talk a bit about opportunities to improve cow welfare in painful conditions. And I'm going to what I'm going to do. Trying to get my slide to let's go to the next slide. I don't know. I can't seem to be able to move to my. Oh, here we go. Now I go. Okay. So what I'm going to do is talk about some general issues about pain control livestock, but I'm actually going to focus more on cows, because if we spent all the issues related to calves and then to cows, it would be we certainly couldn't do that in 15 minutes. But I just want to start off by saying that dairy producers have always strived for the best welfare for their animals, and but really in the past they may not have had all the necessary tools, and that's been part of my research interest is actually to develop pharmaceutical products that actually can result in improvements that gives you the tools to do what you always wanted to do. And it's true, we all know that these improvements we've been doing and they are continuing rapidly right now have resulted in increased profits because we have healthier animals. And the other point really is that we all recognize now we are more than ever, producers and veterinarians are under the microscope by the consumers and inspectors. People that come in and we are under the microscope all the time. And we always know it's the right thing to do to provide to animal welfare. We always know it's the right thing to do, and we know that the consumer is public demand, and that's one of the reasons why we keep changing and improving on the codes of practice. But and everybody who's been working on it, when you make your animals happier, feel better, there is a huge economic gain, which is increase in gain and feed intake and milk production. But there's animals are also easier to handle, and there's huge health benefits. This is kind of a more recently we've been seeing, the more we address welfare and more we reduce pain control, we actually reduce disease. And I'm going to show you some examples of that. I just want to point out that I think most dairy producers understand what the codes of practice means to them, but their veterinarian now is under our codes of practice, under the Canadian Veterinary Medical Association. So everybody is actually responsible for the welfare of those animals on that dairy. And these are the new codes of practice that really relate to it. And in summary, it said if animals are sick or lame or suffering in pain, we have to address that and provide them, do something to relieve that condition. and the and then this is based upon a protocol. So hopefully, if if your herd veterinarian should be able to be providing you with protocols to make sure for each different type of event that'll help you be to address pain in those animals. And I'm going to talk a little bit. The reason I put the downer cattle, because one thing that we often think is the downer cow. How do we address pain? And I'm going to talk a little bit about that today. I just want to put that down because in the codes of practice now, downer cattle have become a very important issue. So I'm just going to say this, so that your veterinarian is also under the microscope. This is the Canadian veterinary medical position, and we as a profession, we must treat all animals that are experiencing pain. If we're there and we don't, our licenses are in jeopardy. And the issue comes with farm animal species. We must provide. We must not only provide things, but we must also educate our clients. We must spend the time to educate our clients. And one of the issues that often comes up is, well, that we don't have label claims for every drug for like lameness or whatever, a lameness or dystocia. But this is very quite unusual. The association, Canadian Veterinary Medical Association, says we don't care about extra label use of. If the animal needs a drug, we don't. If animal needs a pain control, we don't care about extra label. You just need to treat those animals. And so that is kind of a new concept that it really, and I think it's important because producers are always afraid about. And veterinarians were afraid about extra label use in the dairy. And when it comes to pain, that's not an issue. So basically, really, in summary, basically all animals must receive pain control, and producers must be trained on pain control by their veterinarians. And we really should document that what we're doing. And the documentation could be as simple as demonstration to protocols, but it's also very nice that these should be entered into your herd records for the animal. One thing I've always amazed me is because producers have been very creative. They recognize where the problems have been occurring, where there's a painful, and they've been actually already developing protocols and using different ways and been very successful. And these are just some of the things in a dairy that people have addressed, developed protocols. But I'm going to go over some of them because some people don't, maybe not have thought about it. Of course, dehorning and castration in calves, everyone knows, and I'm sure this has been certainly there's a lot of, again, most animals do receive pain control during the procedure and after. One people often don't think about is vaccination. I know, particularly in a younger animal, vaccines can be very painful, and even in an older animal, and we all maybe now have experienced. Some people had to take some pain control when they got their COVID vaccine because they know how much it does hurt. I'm going to be talking a bit about dystocia and normal parturition and how we need to address that. But again, and surgical procedures, again, we probably really recognize that is definitely going to be a painful event. Lameness is something we really need to continue to be working on, because certainly we know how important lameness is related to not only we know it's painful, but it relates to culling of a lot of animals in the dairy. Addressing downer animals and how can we get those animals up faster and without injury, and using pain control strategies, how we can use those. And again, the final ones are things like respiratory disease, stress in the animal, diarrhea in calves, and so on, and things like mastitis. All these require pain products that require a product that will for pain control. Now, many I have to go back and say I am actually. I'm a little bit. I'm not here to try to promote any of our certain products, but I can tell you where we started. I guess it's almost 10 years ago. Producers, because they didn't have the tools at the time, they wanted a label for pain and inflammation control, which didn't exist at that time. They wanted a product that would be fast acting, and but the other thing would have long therapeutic effect. And particularly in the beef cattle industry, where you don't want to bring the animal in every day, it's hard if you wanted a long duration. But even in the dairy industry, everybody doesn't want to, it's stressful in the animal to be treating them every day. So they're looking at long-term pain control. And of course, they wanted something to be easy to administer and safe. And of course, we all know we want something to be affordable. And in many days, when I started this project by saying, the farmer would come up and says, so I asked him, what would you pay for pain control? And I would come back and say, I'm not sure if I can make it for that. But we ended up addressing all these issues when we developed this oral meloxicam product, in which we registered in 2015. I mean, I'm not going to say that other companies now have effective products, and some of them are already, more addressed to a milking cow that you want, or maybe a better than a milking cow that you may only want very short-term pain control because of the milk withdrawal issues, and because one of the problems with longer-term pain control means you got to hold the milk back a longer time. And for example, this product, it's 96 hours. But the NSAIDs really are the products that most people are going to, and it really is because they've been very good at stopping peripheral and central pain. And actually, so an NSAID stands for a non-steroidal anti-inflammatory drug. So really, that's what that really means. But they actually been very good at reducing pain. And again, most of the people use these all the time, so we actually know how well they work in pain. Like if you take an Advil pill, that's an NSAID. So one of the issues that we always do is, and this goes for different species, is how long does the half-life, and half-life relates to how long the drug is going to work on your animal. And I can tell you that's why we went through oral, because we got by far the longest duration of time. Now, it doesn't, some of the other, but on the other hand, we do lose the issue of milk withdrawal because it's 96 hours. Some of them have a much, like a aspirin treatment. I don't think there is a milk withdrawal on it. So, I mean, some of them are very short, or the thing with ketoprofen, there's no milk withdrawal. But the problem is, do you have a milk withdrawal? So you're trading one thing for another. And I think that always needs to be considered when you and your veterinarian develop their protocols. And that's why I said we looked at meloxicam, and that this little curve, the upper curve is actually oral meloxicam. The lower one is injectable. That shows that because we're able to use a little higher concentration in the oral formulation, a product in the oral formulation, and it is actually taken up a little slower, and actually it does last longer. So we have 56 hours of pain on the label. We have 56 hours of pain control. So really, where does this apply to your business? And I'm just going to show you some of the research we've been doing over the last years relate to dystocia and normal calving. Of course, most people would believe that, yes, if you have a difficult calving, there's going to be significant pain. But most people, and particularly the wives, would tell you having a baby is a painful event, no matter what. And in humans, we always get pain control. And so we asked the question, what effects could how could that affect just giving every cow pain control when they have a calf? What benefits or the lack of benefits are there? So we've done field trials in Alberta, Ontario, Quebec to actually look at this issue. And so we want to look at the impact of oral meloxicam administered on productivity, health, and longevity in the dairy cows. That means how long this relates to culling. And we were quite amazed at the results when we looked at, and this is we've actually done studies on over 4,000 cows. Half of them got oral meloxicam, half of them didn't get anything, and we consistently find that when you give cow, you actually significantly increase your milk production per day. That means that the animal starts starts eating, and they actually reach their peak production, and they maintain that longer, just because when you started, when they were in pain, if you could relieve the pain, that got them eating faster, got them getting through the transition period better. And it really did vary between farm to farm. Some, and it related to the highest producing farms, and you can see this is and these are the different monthly test days, but it really varied between farm to farm. And this farm, it was basically a spectacular increase in milk production, but other farms it was less. But in general, we always saw a beneficial effect. It worked out to be about 0.46 kilograms more milk per day, which actually relates to a significant amount of that significant amount of milk also allowed you to reduce your cow herd and produce the same amount of milk. So actually, there's a huge amount of economic benefit to doing that. We also found that we looked at subclinical mastitis based, and so we also found that there was also a significant reduction in the risk of getting subclinical mastitis. The other thing that really is quite significant, if an animal's in pain, they don't go through the transition period well, other things show up that allows us to call, like lameness, metabolic and GI disorders. So, and of course, no one wants to cull their animal in the first 60 days, but we had, because you spend all that money on it, and now you want to keep around milking. So we found that we'd actually reduce the risk of them being culled by 50%. So, which is a huge saving. It's probably as big a saving for the producer as actually the milk production. So the conclusion from our field studies, and this is all published in the literature now, is that we can increase by actually just giving one treatment of meloxicam at calving. We can increase the milk production. We can reduce the risk of mastitis, and we can reduce the risk of culling. We can not only is we're providing well for these animals, but we're also increasing milk production, and I think the other thing is final is that we can go to anybody and saying every one of our cows gets pain control, which is a calf, and all the consumers love to hear this. So right now, we're actually extending this into dystocia in cows, and we're planning to get 165 cows across Canada. We're doing this in Alberta, Quebec, and Ontario.
Merle,
yes?
it's Jody. Could I interrupt you?
Yes.
Just for the sake of time, and I think you nailed it right at the start of your presentation. Like, this is a big subject, but in the promise to attendees that this was going to be a coffee talk, would it be acceptable to you if we had Thomas do his presentation, and then during the Q&A we come back and have you go through the rest of your presentation?
Okay.
Would that be acceptable? Okay. Sure. I will have you stop sharing your screen then. And yeah, while you guys are doing that, so just a little bit about, Merle and Solvet. Alberta Milk's been working on 2 research projects with them on pain management. And I think, there's some great information, and not only that Merle will continue to share with you about the opportunities, the requests that are coming to him as a veterinarian, as an entrepreneur, to provide solutions. And I think Merle's going to touch more on that. While Thomas is getting his screen set up. He's going to present, I believe, on some results that he did at UBC, just on animal behavior in response to pain. So I will stop sharing and I will let Thomas take over.
Okay, is the screen okay? Everything is working out?
Yeah, it's perfect.
Okay, so yeah, thank you for the introduction, and thank you for having me here for the coffee talk. So today I'm going to be talking about some work that I did during my PhD at the Animal Welfare Program at UBC, which was on painful procedures and especially on disbudding. So I'm sure most people here are familiar with disbudding, but just to clarify, it's a practice that's very common on dairy farms that is done to prevent horn growth. The definitions sometimes vary, but when we're talking about disbudding, it is when the procedure is done on young animals, so usually around 1 month old. There are many ways of doing this procedure, but here we're going to be talking about kind of the most popular method, which is hot iron. And there is a lot of research on disbudding, but what everything points to really the similar direction is that if no pain medication is used, really it's something that's going to be very painful for the animals. So right now in the Dairy Code of Practice from 2009, it states that in a requirement, the pain control must be provided when this procedure is being done, but it's not very specific when it comes to what should be used as pain medication. So this dairy code is currently under revision with the newer version that is currently a draft is more specific about what needs to be done with the pain medication. So it needs to include some local anesthesia and systemic analgesia. So the local anesthesia is something that's going to help with numbing the nerve and helping with that acute pain, and systemic analgesia is going to be more about the inflammation and controlling for that pain that comes afterwards. So what I'm going to do here is talk about a couple of studies that we did that is going to try to really illustrate why this shift in the dairy code is happening for this procedure. So the first question that we have is, how are we going to measure pain in calves? So in humans, the most common way of measuring pain is really by just asking the patients to kind of describe or to rate their pain on some kind of scale. Of course, it's not something that's possible to do with animals. So we need to find some kind of proxy or some alternative to this. And this can be done through many ways. It can be through, for example, physiological markers like cortisol, which is a stress hormone, or it can also be with some behaviors, for example, looking at how many times is the calf going to scratch their head. But here, what we're going to be doing is looking at how the calves remember the procedure. So what we're trying to do is to see how much of a negative memory is the disbudding procedure for the calves. And the way we're going to try to do this is by relying on this idea that the more negative something is, the more it's going to be avoided. For example, if you go to a restaurant and you have a very bad meal over there, then you're probably not going to go back to that restaurant again. So we apply this idea to disbudding with something that's called conditioned place aversion. So we made that big pen that you see here with the 3 sections. 2 of them have those kind of shapes on the walls to make them easy to tell apart for the calves. And what we're going to do is we are going to bring the calf in those pens, and they're going to get disbudded with local anesthesia in one of the pens. And in the other pen, they're going to receive a sham procedure or a fake disbudding. And every time we're going to leave them in there for a few hours. Now, once the calves, they've received both of those fake and real disbudding, we're going to wait a couple of days for them to recover, and then we're going to test their memory. So to test their memory, we're going to bring them back to that whole area. And this time we're going to let them kind of roam around between all the different pens. And we're going to see how they spend their time and where they choose to lay down. And the idea is that if they remember one of the procedure as being more negative, then they will avoid the place where they experienced it. So the prediction that we have here is that the calves are going to avoid the place where they got disbudded. So for the results, this is pretty much what we saw. You see on that first graph here is the percentage of time spent in the pen where they were disbudded. And if there was no negative memory of the procedure, then you would expect the calf to spend around 50% of their time in that pen. But in fact, they were mostly avoiding it and spending less time in that pen than in the other one. And it was also similar result where the calves kind of chose to lay down with, over the whole experiment, only a single calf lay down in the pen where she was disbudded. So the takeaway from this study really is that overall, disbudding is a negative experience for the calves, even when using local anesthesia. So this graph that you see here is what we think is happening with the pain in the hours after disbudding. One thing that we know is that local anesthesia is going to be effective for 1 to 2 hours. So we think that kind of negative memory that we're seeing from the calves is linked to the post-operative pain. So what comes afterwards with the inflammation. So to kind of test and confirm this, we did another study, but this time we introduced analgesics, which are the NSAID drugs that were mentioned before, that are supposed to help with that inflammation and that post-operative pain. So we also used meloxicam under the brand name Medicam because it's something that is very common on farms. So for the experiment, it was similar as before with those 2 pens, but this time the calves were disbudded 1 horn at a time, so 1 horn in each of those pens. And in one of the pens, they were disbudded using only local anesthesia. And in the other one, they were disbudded using both local anesthesia and some meloxicam. Now, just like before, once they had experienced both of the disbudding treatments, then we waited a couple of days and then we tested their memories by letting them kind of roam around. For this experiment, the prediction was also that the calves would avoid the pen where they did not receive the analgesic. And for the results, it was also as predicted, with the calves spending less time and being less likely to lay down in that pen where they did not receive the Medicam. So the takeaway from this study is that using this combination of local anesthesia and some analgesia were effective in controlling kind of more of that pain and that negative memory that was forming for the calves. We're not exactly sure by how much it was effective, but we know that it was enough to make a difference for the calves. So in summary, I think the take-home messages from those couple studies are that disbudding is a negative experience for the calves that is going to make them kind of remember and avoid the place where they experienced it. And that local anesthesia is good at controlling some of the pain, but not enough. And that to have some kind of really appropriate, effective pain mitigation strategy, we need to be using both local anesthesia, which is going to help with that acute pain, but also some analgesia, which is going to help with that longer-term inflammation. And this is what is reflected in those changes to the dairy code. So finally, I'd like to thank everyone who was included in this study, especially Dan Wary, Nina van Keiselink, and Benjamin Lecor, and also thank all of the industry partners who support our research. And thank you for your attention.
Thank you, Thomas, for that wonderful presentation. I'm going to throw a question at you from the chat, or Dennis can field this too, because there's one in particular related while Merle is getting his screen back up. The question was, were any of these trials done using Rompin with lidocaine?
Yeah, so for all the those trials, we did use Wampum. So before we brought the calves to those pens where they were disbodied, they were in a chute where they got oral milk reward as a distraction. We would give them the Wampum injection at that time. Usually they wouldn't even react to it. Then we led them into that pen, let the Wampum take action, and then we would do the procedure.
Okay. Thank you for that clarification. I can imagine that's going to create some more discussion once we open the Q&A back up, but I'll turn it over to Merle again to finish his presentation.
I guess we're on. So yeah, thank you, and I'll continue on with the dystocia. And this actually study we're doing is a regulatory study, so it's pretty complicated. But to make things simple, we've been looking at dystocia cows and basically cows and heifers, and right now we've got about 130. We got another 30 to go. This has taken us quite a while because this is a very selected group of animals. So far, we have no significant interest. But one thing that we have found, and as I want to bring this up, is that every single one of, almost every animal that we have a dystocia, even though our dystocia is even defined as taking longer than 70 minutes, we would see vaginal tears. So, and vaginal bruising. So this is just a typical example. I was always surprised because most people often don't go and look. So you always find these things, you start looking. And so obviously there is a real need for pain control post, particularly in dystocias. Not sure why that's not changing slides. So I just want to go explain what whenever whether it's a normal calving or a dystocia, you ask us why is this helping? And really what happens when you give an anti-inflammatory drug like meloxicam, you do actually reduce pain and reduce inflammation. But what that really does, when the animal's feeling better, they start eating better. And I have always said that the best drug we have is food. And this, whether it's an elderly patient who's sick or whether it's a cow, you can always tell when they're getting better because they start eating. And so, and I always say, so the best drug we ever have is food. Once they're eating, we get more milk production and we can improve our health. An animal that's not eating sufficiently is more prone to getting lameness, mastitis. And so if you can get the animal, the sooner you can get your animal eating after a calving, whether it's a regular calving or dystocia, the healthier the animal is going to be. And there also, the big payoff is there's going to be less culling. I'm going to kind of end on a topic that we've been working really strongly. We've been working very closely on the area of downer cows. And of course, everyone knows milk fever and hypocalcemia, and certainly there is, and we actually make an oral bolus, and so do other people. And people give them intravenous calcium. But a downer cow is actually an account that also will experience a significant amount of pain. And we've been looking at also that mostly a lot of, so the top picture you can see here, that's a typical milk fever cow. But the bottom one is an alert downer cow. She looks kind of okay, but she can't get up. And a lot related, that's the hypophosphatemia. And we were asked to try to see if we could, we can address some of this problem. But I should point out that not only, they said, well, the cow stands back up again, but she's been laying on that floor for a significant amount of time. It's a hard floor. She gets muscle necrosis just from laying on the floor. And that causes a lot of pain. And so an animal that is a downer animal, even though they get up, when they get up, they still are in significant pain, and that needs to be addressed. So we've been looking at alert downer cows, But we found actually during postpartum, particularly in second lactation and over 80% of the postpartum cows are hypophosphatemic. I'm sure everybody's experienced. You give her a bottle of, the cow gets a bottle of, gets some calcium borgluconate, but then she goes down later, or she takes a long time to recover. So we've been looking at actually combining. We developed we developed a phosphorus bolus, which did not exist. One an easy way to administer phosphorus. These animals respond. So we've been providing veterinarians around these studies, and basically, I'll give you we're just writing this publication up, but basically, we were able to get, if we've been able to get over 90% of these cows up, they got the bolus right away. But the other message is that if you leave that, the longer you leave that cow down without treatment with phosphorus and calcium, because all these cows needed both phosphorus and calcium, the longer you leave the animal, the more damage is done to the muscles, and the less chance the better chance of that animal's down. And the animals that end up dying were the ones that we started too late on. I also wanted to brief us on lameness. We've been looking at lameness and losing meloxicam. And again, we've been looking at non-infectious lameness. And the summary of it, if you do pain control at the time of with an NSAID, you can get about a 92 response rate. This is actually non-infectious. And of course, some of them, even we had some lame cows, we just gave them saline, they recovered. This is probably a fairly minor lameness. So I think one thing we really know that pain control for lameness is very important as well. And you can get about a 92% response. And again, it's the same production. If you can address the lameness, the pain from lameness, you're going to get a more productive animal. Finally, I just want to say it's really important that we provide to the public how we're addressing. I know we're all doing it, and we're getting better every day. We need the public to know it, and actually, and we need to let them know whenever possible. So we actually started this kind of I Care for Cattle campaign, which is basically so we can you can put it on your bumper stickers or wherever. And certainly we have some of these. We can provide the Alberta milk and to other to any of the producers, so you can provide this to people, let people know that actually you really do care for animals. And I think we just got to keep driving this message home. And I said we have bumper stickers and coasters and balloons. This is the top right hand is actually like the Calgary Stampede, showing that, trying to tell people that people that actually we do everything to take care of our animals and make sure they're not in pain. And I think that message, we just got to keep driving that message home. And anyway, I'm happy to answer any questions after this.
Well, Merle, thank you for the great presentation. I would just ask you and Thomas turn your videos on, as well as Dennis, and we'll open this up to the Q&A. There's already quite a few in the lineup. But just even highlighting, I think with your last slide there, the I Care for Cattle, of really producers have for a long time. I mean, they do care for their cattle. Sorry, I'm bumbling over my words this morning. And it's with the advent of pain medication that really the demand comes of, now that we have it, we want more. And, you know, I think, Merle, you're highlighting the work that you're helping us get over some of the stumbling blocks of administration and whatnot. So again, I will, well, for a short time, probably stay silent. I'll turn this over to Dennis to facilitate the Q&A. So again, just type your questions in there or raise your hand if you'd like to ask it live.
Right. Yeah, no, that was a great presentations, Thomas and Merle. I think from my perspective as a veterinarian, I think there's been a huge uptake in using pain control on dairies. Even in the 10 years I've been in practice, from when I started to now, the uptake has been huge, especially with calves. And I think it's because the results there are really noticeable with calves. And so producers say, oh, they go back on their milk quicker after dehorning and whatnot, right? I think the area we've struggled gaining traction on is with cows. And um, lactating cows. And I think that's because, well, this is my perspective anyways, is one is the work aspect of giving oral meloxicam to fresh cows is a struggle. The other one is, I think, milk withdrawals and not being able to recognize a painful condition when they have one, right? And so I think it's easy to see a lame cow as painful and a cow that had dystocia as painful, but to see a cow that has mastitis or a touch of pneumonia and convincing guys to use pain control in those instances, especially when they're using an antibiotic that has no milk withdrawal. So I guess just to start off the discussion, how would you guys address that, or how would you address that with producers?
Well, I mean, I think we had to kind of just, there's a milk withdrawal, like for example, whether using injectable or oral meloxicam, they're of 96 hours, which is probably which people are tend to be using. But you have to look at the downstream. You have to, with the producer, you have to keep passing the message. Yes, you have to throw away that milk for 96 hours, but look at the downstream. You didn't have to call that animal. You don't have to. I mean, you're going to get better milk production out of them. She's going to. So those, it's an economic benefit because. And that's why we actually did that one large study. You have to do huge studies to show economic benefits, but it's every time we turn around when we do pain control, there's an economic benefit. So yes, there's a short-term loss, but for a long-term gain, and that's what you have to keep driving that message home.
Yeah, I certainly think that message has been driven home. So, we have a couple questions here, and I'll just ask them. There's a few for you, Merle, on meloxicam and using in fresh cows or cows that have just calved. Would you give meloxicam to all cows at calving, or would you be a little more selective?
Well, we right now the way that we have in a lot of the approach, we've been giving it to every cow. Now what we know, I'd give to every cow. The benefit is there, and also it makes it like, you know, we like any of our business. That's a routine. It's if you set up a routine, I'm going to give every cow that. Then it's all the routine's all set up, and you just follow them. And the producers that are, you know, that are using this, and it's just that are using it are part of their routine. They don't even think about it anymore, and they wouldn't. And they've recognized the benefit, wouldn't go back. So I mean, as soon as you start making things non-routine, it's harder to actually follow. You know.
Yeah, for sure. So all cows. And I think you touched on this in your presentation, but there's a question on how does meloxicam or oral meloxicam compare to Medicam or an injectable meloxicam product?
Yeah, I mean, if you had about 3 days of pain control and oral, you have about half that amount of time in the injectable, and it just relates to the pharmacokinetics of the drug.
Yeah. And then another question was, did you test the use of meloxicam after calving on different breeds of cattle, and do you think the result will be similar versus Holstein, I guess, versus?
I think in our studies, they're pretty well all, they were pretty well Holstein. However, we've actually done it on beef cattle, of course, with particularly more dystocia problems, and we've actually seen a behavioral benefit. It's over. Economic benefit was really hard. It's really hard to measure in a beef animal, but I know in beef cattle, in people doing surgical procedures, they do it. But I don't think, I can't imagine why it'd be different between any different breeds. In fact, an animal like a Jersey which seem to be more sensitive to pain, would even be the dramatic effect. The effect would probably be more dramatic. You know.
Right. I'm getting lots of questions on the meloxicam here. You know? If you're treating fresh cows with NSAIDs, is there any issue with the residual, the transition milk fed to calves?
No, actually, we look at the amount of meloxicam in that milk. The milk that's actually if you're using the milk you're collecting and feeding that to calves, it's an insignificant amount of meloxicam in that milk because it's so diluted. So really that's really not an issue. On the other hand, it's probably not going to hurt, particularly those cows are really prone to diarrhea. Probably it's not going to hurt them anyway. So, anyway, but we've never seen any issues.
And no issues with giving a calcium bolus or a phosphorus bolus at the same time or anything like that.
Well, actually, it's a good point. We've actually looking very clearly. So no, actually, haven't had any issues giving calcium bolus and the same time. In fact, we had to develop and you can talk to our field veterinarians, but we developed a double bolusing gun so we can actually give 2 boluses. The hardest part is putting the bowling gun down the throat the first time is not so bad. The second time is always tougher because they see you coming. So and in fact, we often recommend if you can get 2 boluses into them right following calving, that's probably going to give you the maximum benefit. I mean, before we had a bolus, I mean, people were using, that's why we developed this, because they were using drenches. Nobody wants to give a drench because that's the alternative. And a lot of times the veterinarians would, particularly this happened more in Ontario, they would often, when they treated a milk feed, they take a blood sample, get back to the office and find out, holy smokes, their phosphorus is so low, they had to run back out and treat it for phosphorus. So the problem is we often don't, when we treat a cow for milk feed, we don't know how severely phosphorus deficiency is. And that's why that's why we kind of developed something that's going to be easy way to administer a phosphorus treatment.
Jody, your hands raised.
Yeah, I was going to throw a question on there, directed at Thomas. Because I think sometimes when I've heard producer discussions, there's a lot of extra work. And so even what Merle's touching on about boluses. So Thomas, when you were training the calves with the milk reward, could you quantify how much time that took?
I mean, it wasn't really training because it was just bringing the calf to that chute that was in front of the apparatus, and the milk bottle was just there. So it was just about kind of putting the fingers and leading them to the bottle. I mean, we didn't have something where, you know, we would open the gate and the calf would kind of run by itself and go all the way over there, but it was just to kind of facilitate that first injection. But yeah, they were fairly fast at just figuring out that the nipple was there and start drinking from it.
I have a question too, Thomas. Back to the Rompin or the xylazine question. When you did your study, did you give them enough Rompin to put them right down in recumbency, or are they still standing?
No, they were in recumbency. So the recommended dose is between 0.1 and 0.3 milligram per kilogram, and we did 0.2. So usually we would wait like between 5 to 10 minutes, and then they would go down, and that's when we would do the lidocaine block. And when we did the Medicam, that's when also we give them that injection.
And is there any benefit with Rompin in terms of pain control? Because it has a mild analgesic effect, but not very long. So is it any different than just doing lidocaine without Rompin?
I'm not sure. So yeah, we didn't test for the analgesic effect of Rompin by itself, but I would say it has happened where we failed the lidocaine block or something like this. And you can clearly see when there's a problem, or at the beginning, we wouldn't wait long enough for the lidocaine to take action. And I don't think the xylazine is enough to cover for this kind of pain. Yeah. And since even for the meloxicam study, we did also every time provide that Rompin, since our control had the Rompin plus lidocaine, and the other one was the Medicam, also had that treatment. And we did see a difference. It means that, you know, it's not enough of having just the xylazine to cover for that pain.
Right. The only reason I bring that up is because lots of guys want to use Rompin, which technically as a veterinary professional are not allowed to give out. Right. And so I tell guys often that you get the same benefit just from using lidocaine and meloxicam. Will give you the same pain control without the Rompin.
Yeah, we didn't try without the Rompin. I mean, it was really common practice where on the farm they always use Rompin, so that's why we we did this, and also it makes it way easier for the lidocaine injection. We don't have to restrain the calf. So, because when we're doing those kind of designs where we're looking at how the calf remembers the procedure, then if you're doing kind of a handling for this kind of injection, I think it's going to vary a lot for the animal. Sometimes it's going to go well, sometimes not so well. So it might be kind of a big factor. So we just went with kind of the easier method of having them down.
Another question I had for you, Thomas, is with the pain control in calves, we often talk about short-term gains like average daily gain, and calves are back on feed right away and stuff like that. Is there any research on long-term effects if you don't use pain control in terms of the animal's temperament in the future?
I don't think I'm very familiar with like those kind. I'm not sure there is too much on it of, you know, those short action at the beginning and how much is going to affect them later. It's something that we are kind of working on currently on how those early pain experience for the calves is going to affect how they deal with pain in the future. But those trials, they're ongoing, so I can't really like talk about the results or anything because we don't have them yet, but it's something that will come out eventually. Yeah.
Okay. Merle, there's another question for you on treating fresh cows with naloxone. A normal calving versus a hard calving or dystocia, would you, obviously the dose doesn't change, but would you do more treatments, repeat in 3 days?
I think most of the times I wouldn't normally repeat in 3. Usually the address of pain in the animals who have been going so far, they didn't need a second treatment. We could have particularly those dystocia, some of the ones that are even with a lot of bruising, the treatment got rid of a lot of the initial swelling and bruising within the first 3 days, and so I don't think I don't think you need to. And then of course, if you retreat in 3 days, then you're going to have to extend the milk withdrawal for another 3 days. So I think only in the rare case where the animal has got some severe problems that you may need it. I think maybe a down cow that's been down a while, that's the only one I could think may need longer treatment, because it's surprising how much damage, inflammation, and how much tissue damage there's on a down cow. And maybe that's what, but most of those ones end up, if they're down too long, they end up dying anyway. That's one of the problems. But that would probably one of the ones that I would, the only time I'd actually think about repeating.
Right. Yeah. Okay. There's a question here too, not on pain control, but just on phosphorus versus calcium deficiency, because he touched on that.
Yeah.
How do you recognize the difference of that, and how do these boluses compare to the fleet enemas? So we used to always use fleet enemas.
Yeah, I know. Yeah, I know the old. Well, I mean, we compared the two. I mean, both of them will increase the phosphorus in 2 hours. So there's a rapid response. Whether you use a fleet enema, but it's certainly much easier to give a bolus than try to pump or IV a fleet enema. So I mean, people did both, you know. So we really, so that's why it makes it. And this way, because also when you need a fleet enema, you got to run into the pharmacy and buy one and come back out. And we all know that story. The best thing is these boluses, you can leave them around and they're available at the farm when you really do need it. So that's the recommendation is actually when we have when you've had a alert downer cow, is to treat them for up to 3 days. Certainly we see the response very quickly, and the question is, do we need to keep treating them? I don't know the answer, but I know the first two are really important. But I was very shocked to find out how many hypophosphatemia cows we really do have out there.
Yeah, I think there is. Yeah, we always call them the creeper cows, right? They still kind of crawl around sometimes, and they're alert and bright.
Well, so the symptom of hypophosphatemia, actually, there's two symptoms. The two major symptoms of hypophosphatemia is actually muscle weakness, and the other one is anorexia. So actually they treat children who are anorexic with phosphorus, oral phosphorus. And I do think naloxone can help getting them eating, but actually just the fact of getting the phosphorus up to normal stimulates their appetite.
Yeah. Okay, Joe, do you have any more questions that you like to ask? Or?
I do. I think there's a follow-up one if you want to take it first.
Oh, yes,
yeah.
there is. Yeah, just how do we tell the difference then between a down phosphorus cow and a hypocalcemia?
Well, I think the only way you can tell is if you give her calcium, she still doesn't get up. Then you better think of hypophosphatemia. But remember, that's severe. That's really severe. Subclinic hypophosphatemia, you can't tell the difference unless you take a blood sample. I mean, that's really the only way for us to know is by a blood sample. And so that's why we've been spending so much time taking blood samples of cattle, even of normal parturition and dystocia, to find out how they do respond. And another good example is most ketotic cows, because they're not eating, are hypophosphatemic as well,
Yeah, right.
Yeah, no,
So-
if I could throw in
So
something.
I'm just going to someday, Jody, I can give a talk on all the work we're doing on hypophosphatemia, and maybe it's another time we can do that. I'm happy to have a discussion on that in itself.
Good to know, because there seems to be a never-ending appetite for information. I'm always amazed when we do these, and it might even just be the topic we've already delivered on, and there seems to be more questions. So yeah, whether it's the same topic or a different one, there seems to be a never-ending appetite for knowledge in this industry. I was going to throw something. There's a couple more questions that have popped up. One was just a thank you. And this would be, if this creates any food for thought for anybody in attendance and or the two presenters or the facilitator. So what research might need to be done? What product development would anybody like? Or do we just need to work on skill building? And I'm thinking particularly in the area of, again, in industry, we have male calves. Typical is band castration. I'm not sure, Merle, if you can speak to that, and I'll just wrap up here before you jump in if you can speak to some of the work you've got going on. The other thing that I've heard on around lameness is some of our trimming procedures can be quite painful, and again, there's the challenge in who's available to administer pain control at that time, the risk to withdrawals and potential complications with bulk tanks. So there are other opportunities for pain management around that one. And then not common in the dairy industry is branding, but there are some herds that do brand. I know the code of practices for dairy is suggesting that branding not be allowed, but there are other industries that still will have branding as part of that. And so, just again, that's one of those, let's say, maybe more obscure pain control things where it can be more challenging to administer and or you're needing the longer impact pain control. So I will stop there and see if that stimulates any questions from attendees, but certainly for any of the three of you, Merle, Thomas, Dennis, if you want to speak to any of that of what you're seeing.
Well, number one, we are actually in the process of doing registration studies for a lidocaine impregnated elastomer brand. We've shown that those bands will provide pain control at the site within somewhere between an hour and 2 hours. So actually, we have just the same thing as giving an injection, and that lasts. We're up to 28 days. So we've actually, so that last treater band, and we are working on, for lameness, we're actually working on a lidocaine bupivacaine spray for when you trim hoof and you expose a lot. So we can actually provide topical pain control for people trimming hooves and as well as for dehorning. It can be sprayed on the dehorning site as well. Anyway.
Yeah, just a word of caution or advice on the castration. There's been some work. I'm not completely familiar with it in our lab, but when it comes to kind of constriction-based castration, so the band, the rubber ring, and all those kind of things, it looks like there is some very high kind of painful phases, and it goes even beyond 28 days. So it's something. It's good to have kind of those methods that can control for that first month, but it's good also to know that pain might be way longer lasting than this.
I think there's some good research in the beef side on castrating and use of meloxicam and
So
stuff like that.
yeah, certainly we've certainly done on the certainly that's what our product's got a label claim for castrating. It's very from oral meloxicam. But on the other hand, so I can say right now that we've done it up for 28 days. We measured lidocaine measurement at the site for 28 days, and it's above therapeutic levels. Actually, we're going to 42 days, and that's when the testicle falls off. So we will actually have data up to the when they fall off, and we're also doing the work on lambs as well for tail docking and castration. So we're actually got studies going on in Canada and in Australia going right now.
And for branding, I would I don't know of any dairies around here that do branding, but I would treat that just like dehorning calves. And
yeah, we actually showed a huge difference when we started using it on branding beef cattle. You can see it immediately how with the oral meloxicam. And a good thing, it lasts for about 3 days, and they're going to need pain control for 3 days because that hurts. The one that I was surprised is that we got people using it for vaccination on calves, because we don't realize how painful a vaccine, particularly that 7 or 8 way vaccine is. And I think I think we've all vaccinated, seen some calves limping around for a few days after that's one that often we don't think about.
But is the local block going to be as effective doing branding as doing dehorning?
probably not a local block. But,
No, the local
Yeah.
block.
Yeah, for that time, it wouldn't work.
So you need it long term. For branding, it's really long term pain.
Yeah,
So
but
local.
But there is no way of controlling that pain and doing
No.
that short phase. Yeah.
No.
Merle, and I guess following up on Thomas' question, and this is top of my mind or whatever, because I actually did run across a dairy herd the other day that does. And so knowing that some of the challenges that maybe kind of map with code of practice, if it's disallowed, but if it's not, is there anything in the works that you have thought of for, let's say, immediate pain control, like topical could be applied pre-branding and then layered with like a longer term pain control?
Well, we looked at we're actually one of the things that's one of with this spray that actually we're developing. It's kind of a weird spray. It's it's called a thermal reversible spray. That means it actually it's a liquid at room temperature. When it goes onto a body where it's warmer, it becomes a gel. And so our thoughts is you may be able to actually brand right through it. Spray that on and then brand through the gel. And actually, this way you're actually delivering, maybe you'll be able to deliver more pain control right at the time you're actually doing it. But we use this thermal reversible gel because our biggest problem with a lot of this stuff is how to get it to stick on the site and go penetrate through. And that's why we're using this technology.
Thank you guys for the great discussion. I see Dennis is typing some answers in there. There's a couple left, but I mean, maybe I'll let you wrap those up, Dennis.
Yeah, just is there any adverse effects from using meloxicam in calves, or using it?
So we're using it. So if you're talking about safety wise, again, we've been using it for years, both pre-ruminant, ruminant, and we've never seen, we have never, because we're worried about kidney damage and so on, whether using injectable oral, we have never seen or had reported an adverse event. And I've been doing this since 2015, and and certainly if there's an adverse event, because we sell other drugs, we'll know about it right away. Like people tell us. So haven't yet to hear it, but that's always a risk. Anytime you use a drug, there's always a risk of an adverse event. Nothing is 100% safe.
What about for calves with scours? Is there any downfall to using an oral NSAID?
No, actually, again, we did the pharmacokinetics and compared them, whether it's oral or injectable, and we found no difference. Actually, even in the time for onset's the same. Most of naloxone is absorbed in the esophagus. Time to onset's the same, and the only thing is the duration is longer. And I would never, on the other hand, a calf, I would never give 2 treatments of meloxicam, because a little calf, it's at least 5 days. It could even be longer. They have therapeutic levels. So I would never retreat a calf, a young calf with meloxicam, or probably even injectable. Also, the younger the animal, the longer they work, the meloxicam works. So, so I with oral, I know we have therapeutic levels for at least 5 days.
Yeah, good to know.
And it doesn't matter. You can put that in the milk if you want to do. I know some people when they do their horning, they just put it in their milk before they treat them, and then they're all treated. They don't have to even squirt it in their mouth. And there is no difference whether you put it in the milk or you put it in squirt it in their mouth.
Right.
So,
is it advantageous to give cows meloxicam prior to calving? Like if we can get them 6 hours before? Or so?
well, of course, the biggest worry because we know with flunixin, that if flunixin, it will cause retained placentas. Now, studies have been done with oral meloxicam beforehand, and that has not been an issue. But it's always something in the back of your mind. Think it may be a problem, but the people have found that giving it before and giving it after really probably doesn't make any difference, and probably they probably just like humans, they usually give the NSAID after they had the baby.
Okay.
Again, I'm always amazed at the appetite for information and the willingness to share information. I want to thank you, Merle, Thomas, so much for sharing all your knowledge and the work that you've done today. I'm going to throw one question out to Dennis. Maybe, if in your dream world as a veterinarian, what would a pain management conversation look like with your clients?
I don't. That's a good question, Billy. I think we have those conversations with clients, and a lot of clients have uptake it, and that's just, I guess, recognizing signs of pain is one of the big ones, especially in cattle, because they like to hide it sometimes, unless it's obvious, like lameness. But I would say anytime there's a condition that has caused that animal to either drop in milk or drop feed intakes or anything like that, it would be warrant a discussion or warrant a look at, can an NSAID be used and be beneficial? And I think in more cases than not, it can be. So.
No, thank you so much for that. I know even a few years back when we were doing some workshops around pain management, just the desire for producers to know more about the products and where they could use them. And I think it's just heartening to see that there is still a lot of interest and so much work being done, not only in the research side or the product development. So yes, I guess it's a good news story for sure. Just want to say thank you to everyone for your time today. I'm going to give a thank you to Anna Marika Smid. She is a postdoc with UCVM working on contract with us right now to help deliver these events. So if she wants to turn her camera on and give a wave to everybody. But yeah, I hope everybody's found this to be really wonderful. These are going to be recorded and available. So if you want to come back and listen to the presentations again, or listen to some of the discussion that goes on, they will be available and sent out to attendees at the end of the week. So again, yeah, Merle, Thomas, Dennis, thank you so much for all the information and the assistance today. And we'll say goodbye for today and hope everybody has a wonderful rest of the day.
Well, it's been a pleasure. Thank you very much.
Yeah,
Thank you, everyone.
Okay, great. Bye-bye.